Hi guys, Dr. Jon Runion here, and I wanted to do a quick video to explain the differences between really 4 of the main type of prosthetics that we make here in our office. And this is a conversation that I have a lot with patients during the initial consultation, and we really go through each option very thoroughly, have examples of each. We have videos that really show kind of animation and explain everything. And a lot of times once the patient gets a good idea of which one they like, we go down the road further of explaining the different details and how it would specifically fit for that individual patient. But basically when an individual is faced with losing all of their teeth, the main option that comes to mind is a denture. That has been sort of the gold standard to replacing a full arch of missing teeth. It's something that a lot of people just think is what has to happen. You lose teeth, you get a denture. But it's really not the case anymore. The standard of care really is not a denture any longer, and the standard of care is utilizing dental implants to fixate teeth in the mouth. But to go back to talking about a denture, basic premise is you have an acrylic prosthetic, so it's an acrylic base. That acrylic can be customized the color to match the gum tissue of the patient, but the upper has a full palate where it covers the whole roof of the mouth. That's where the term plate came into play, because it really does kind of look like a plate. And then of course there's teeth that are fabricated into the acrylic, and the teeth are custom made for that individual to match their facial proportions, the color, the shape, to kind of match that individual. Ultimately, an upper is made and a lower is made. They're made to come together, so it's very important that all the jaw measurements are done properly and everything is custom made so that it fits together properly. But ultimately, it's an upper plate that goes in because it covers all of the palate and all the way around the ridges of the mouth. There is some suction that's created, and that suction is what holds the denture in place. We rely heavily on the fabrication process to be very precise so that denture can stay in place. A well-made upper denture can have some pretty good suction and some pretty good stability. Compare that to a lower denture, which is going to be more horseshoe shaped. Of course, you got your tongue down there. It sits on the ridge kind of as such, where it kind of goes in like this. Ultimately, that lower denture faces a lot of challenges of kind of moving back and forth and kind of floating up. The patient will really have to go through a learning curve to kind of learn to use their cheeks and use their tongue to kind of hold that prosthetic down and sort of in place. Also, using the upper denture to bite down and hold it will really help the whole process go. In our practice, we always make what's called an interim or an immediate denture, to where once the teeth are removed and during the initial healing phase, once the gums are healed, we make their final denture, which is a high-level customized denture that will restore all of the teeth on the upper and all of the teeth on the lower. So that kind of explains in quick format the denture process. The main challenges with the denture are going to be the stability and the bulkiness. There's quite a bit of material in the mouth, and it just takes a little bit to get over that, and the stability is definitely something that can be challenging with the rocking and the moving. The first thing we do to really attack that initial problem of stability, the first thing we do is add 2 implants on the lower arch right here in the middle. That bone is really solid, really strong, and it can accept dental implants very readily. So what we do is we put 2 dental implants, kind of like such, into the lower arch there, and then we take that denture, we put some connections on it, and we snap that denture into the lower arch. That concept is called an overdenture or a snap-in denture. That enters into the world of what's called snap-in appliances or removable implant appliances. The basic concept is you're using those dental implants to retain or hold the prosthetic in place. The main challenges are still going to be the bulkiness. The material does not change. It's still a denture, so it's going to still have quite a bit of bulkiness, but we get a lot more retention and a lot more stability. Patients that go from a regular denture to a 2 implant snap-in denture are some of the most grateful patients out there. They're very, very glad to get that stability, and it really improves their chewing and overall quality of life. Now for the upper, because there's so much space to cover, a 2-implant snap-in is not an option on the upper, unfortunately. The minimum in our practice is to take 4 implants, spread them out, and do a 4-implant snap-in prosthetic. Similar concept as the lower, only you have to have 4 implants to support it. And that simply has to do with the mechanics of the process, where you have all that space, so you need 4 implants to be able to support that, okay? In our practice, that is, we use a bar to connect all 4 implants and snap that into place. And those are details that we go over during the consultation. The next step from there is a huge transition and a huge improvement for all of our patients. And it's one of the most demanded prosthetics in our office. And that's what's called the full arch fixed prosthetic. And that looks something like this, where it's basically a full arch of teeth that's connected by anywhere between 4 to sometimes even 6 to 8 implants. And the main key is it's fixated into place. So you can see maybe these little holes. Those little holes are where the screws go in and hold the prosthetic in the mouth into the dental implants, okay? The main key there is there is now 100% stability. There's no rocking, there's no moving, there's no flopping around, and the patient gets to keep it in their mouth all the time. So when patients come in, this is what they're asking for. This is what they're looking for. This is the solution that really gets rid of all of those denture problems and really gets you transitioned back into a much more natural and lifelike feel. Like it's almost like you got your teeth back. So this is one of the main procedures that we're doing in our office every day, and it truly can transform your life in as short as a single procedure. Some of the complaints though about this prosthetic are going to be, it's still quite a bit bulkier than natural teeth. Obviously compared to a denture, it's night and day better, but compared to natural teeth, there's still quite a bit of material there. And the second complaint usually is just that transition period, getting used to having a fixated arch, a full arch in there versus maybe a denture or natural teeth. But most patients after a week or so are really getting used to that and loving their new prosthetic. Maintenance is pretty easy. You clean underneath it. We give out water picks as part of our package process. We want to make sure the patients are prepared for their home care. Basically, you just clean out underneath it and you're ready to go. The next step up from that is an option that looks kind of like this. And you might say, well, that looks like regular teeth. And that's basically what it is. It's a full arch of custom ceramic teeth. It's anchored by anywhere between 8 to 10 implants. And basically that's going to be your natural tooth replacement option, where basically you are using implants to retain individual crowns or sometimes small bridges. And this is going to look and feel very, very much like natural teeth, if not exactly like natural teeth. Now, this is a much limited option for patients because you have to have a lot of your natural bone and gum remaining to be a candidate for this option. So we do a lot of education and screening to be able to make sure a patient is a candidate for this before we really start talking about it. But for those patients that are a candidate, it is a tremendous option to get all of your teeth back to that true natural and lifelike feel. So for those patients that do get this, it's a beautiful and wonderful option. But ultimately in our practice, all of these options come with the highest level of precision and accuracy in the design process, the highest level materials. We're partnered with a world-class laboratory and technicians that are fabricating all of these teeth. They're all custom shaded and designed. So we take a lot of pride in all of these prosthetics, from the traditional denture all the way to the individual implant crown and bridges. And we treat each patient with the respect and care that they deserve for their individual case and design something that we are proud of and that they can enjoy for many, many years. So if you have any questions, you can always reach out to us through our website. If you feel like you're a candidate for one of these options, I urge you to schedule one of our free dental consultations where we sit down and go over everything and really decide and discuss what would best fit you. Thank you.